Okay, we're live.
All right, we're live?
Yes.
Okay.
Ronit, are you able to do the intro?
I didn't even realize I was muted. Sorry. Here's another Fresh Channel shadowing session. Today we have Dr. Noor Bilbeisi, and she'll be presenting today.
Want me to get started?
Yeah.
All right. Hi, everybody. My name is Dr. Noor Bilbeisi. I'm a pediatric dentist in Fremont, California. Thank you for the introduction. So I've been asked to share my experience with you guys, and I'm going to try to keep it kind of short and not as boring, hopefully. So that way, if you want to go back and watch, it's not going to be this long, boring thing. So I own my practice. It's called Pacific Bay Pediatric Dentistry. It is a fee-for-service pediatric office in the Bay Area. It's a fast-paced place with a lot of people. So we have a lot of fun every day, and we're really busy. But I'm going to get started on telling you guys about my journey. So we're going to talk about kind of how I began, what my background is, and then go through all of my kind of my steps along the way. So undergrad, dental school, residency, associateship, and ownership. So my background is that I'm a Palestinian American born from immigrant parents who came to this country in the early 80s. And I grew up in Ann Arbor, Michigan. I am not there anymore, but I do call that home. I love Ann Arbor, and I miss it very much. But I've lived in Michigan, New York, New Jersey, and now California. I am the third child out of 7, 6 girls, and 1 boy at the very end. So we had a really busy and crazy household, but it was fun. Still kind of crazy and busy too when we go back and visit. So we have good times. A little bit more about me. I am a mother of 3. Those are my 3 kids there on the right side. I was treating my little one that day, and the other 2 decided to join me and watch TV because I have a TV on the ceilings. So they all joined me. I'm also a long distance runner, do some half marathons and close to marathons in my free time. I also do some TikToks. I enjoy TikTok since quarantine. It's been fun. You can go check my TikTok handle and my Instagram. And I also volunteer. It's a picture of me in a refugee camp in Lebanon where we treated Syrian refugees. That was this past October. I try to do something at least once a year sometimes. I also recently got the ability to give out CE credits to other dentists from California. So I occasionally do that. It happened right before quarantine, so I haven't been doing that much, but it is something that I enjoy. I love teaching, so it's something that I hope to do more of. I started undergrad as a 16-year-old. I finished high school really early because my dad was like, yeah, high school is a waste of time, so you're going to finish fast and you're going to go to college. And so I did that. But I started at a community college, and I want everybody to know that that is an option, and it's a good option. I had great professors. I did organic chemistry 1 and 2 there. I did physics there. I did calculus, and I had wonderful teachers. I learned so much. Sometimes, when you're young, you need something kind of small, and that worked for me. It also saved me a lot of money because college is expensive, and sometimes it's not really worth all that financial burden later on in life. So if there is something that I would recommend is to try to save money when you're young, because that debt is going to pile up, and it's going to pile up fast, and it takes a long time to pay that off. So I'm happy that I did save a lot of money in that sense. Then I transferred to the University of Michigan, and I did not finish my bachelor's because I had all the credits that I needed. I applied to dental school before I finished a bachelor's degree. I was waitlisted at a school. Didn't think that I would get in because I still had Organic 2 to finish. Before I applied before I even finished Organic 2. And then by the time I finished, I got in. So I left undergrad and went to dental school. Again, my dad really wanted me to go early, and so I did. So I was 18 when I started dental school, which now I look back and I'm like, wow, really crazy and very young. But it was a good experience. So I went to the University of Detroit Mercy for dental school in Detroit. It was a good school. It was a good school for me. Again, pros and cons. I got in early, so I went there. That's the school I got into, so I went. I think it's a great clinical school. You become a really good clinician. I had great experience there with restorative and with extractions. So it's just a really good, well-rounded school for clinical experience. I thought the professors were really accessible. They were really wonderful. They really cared, and I had a really good experience again. I loved it. I had moments where I was crying, of course, trying to keep up with everything that I was trying to do. But, after the first 2 years, it's smooth sailing after that. So, of course, there are some cons. It was expensive because it is considered a private school. So I ended up going more expensive for dental school because, again, that's where I got in. So there's not a lot of research opportunities. So if you're somebody who wants to try to do more research, there's very little. I did do research because I kind of pushed for it, and I asked a professor to see if she could, help me out with it. She was doing some dental materials research, so I was able to do that twice, which I think was a great experience. But there's little opportunity. And again, it's not well known. So when I applied for specialties, there were a lot of schools who really, really knew what was going on at Detroit Mercy, and then some of them did. So it put me at a slight disadvantage when I applied for pediatrics. I actually, before I did residency, I actually worked as a general dentist for 2 years. So I finished dental school, practiced in private practice for 2 years, and then I started residency. And I did that because I wasn't 100% sure that I really, really wanted to do pediatrics. So I got a chance to kind of do a little bit of everything, and was really sure about my decision to do peds. So I'm glad I did that too. So I got into NYU College of Dentistry in Manhattan, and I moved there with 2 suitcases, no furniture, and a roommate that I didn't know. So it was a wonderful experience. I love Manhattan, and I would live again in the city in a heartbeat. I loved it. Really good program, great residents. We had 10 residents in our program. We had a good variety of hospital and academics. Great professors. It was just a really well-rounded, kind of laid-back school, which I loved. It was perfect for me. So associateship, I did that for a couple of years after pediatrics as well. These are 2 of my staff, actually. But the reason I put them in here is because when you're an associate, you don't have to be the boss. And so pros and cons for me, of being an associate was I kind of had a more flexible schedule. Like I didn't have pressure to always be there, always be around, always be on call. Of course, I'm not always here and I'm not always on call, but there is some pressure for that. I didn't have to worry about overhead. I just went to work, did the dentistry, and went home. I'm not worried about the bills. I'm not worried about all these other finances that I have to worry about. I also don't have to manage staff, which I know these staff are wonderful, but staff issue is a big deal. When you're an associate, you can leave at any time. You can quit and just go somewhere else. You can move anywhere. So it's kind of no commitment. It's nice. You also are able to learn skills and procedures from the owner dentist, which is great because that's like free CE credits right there, without getting CE credits. But, you learn how to do some things that you might not necessarily would have figured out yourself. And it's nice to kind of bounce ideas off of somebody else, somebody who's more seasoned. So that's the good part about it. The cons are, it's not as stable. You might find a job as an associate for 2 days a week or 3 days a week. You might not find 5 if that's what you want. You might not find only 2 if that's what you want. So sometimes you're kind of restricted as to what the dentist needs. Of course, you don't have to manage staff, but you also don't have control over staffing. You don't have control over who they hire. If there's somebody that you don't like, you can't go and fire that person. You might not have materials choices. You might not have hours choices. So in other words, I want to work, 10 to 2. I can't do that if I'm working for somebody. They're going to expect me to be there around 9 to 5. And so, if you want specific hours, that's going to be a little bit of a challenge. And of course, you never feel like the boss if that's important to you, which it was to me. I kind of want a little bit of control over my day, over the way I practice, and over the way I kind of, interact with people. I like being the boss. I know I'm not bossy, but I do like being the boss. And then of course, sometimes there's limited hours. So sometimes, so for example, I have an associate. I only work 2 days a week. And actually, there's even less than that. Some weeks she won't work on certain days. So it's really limited. So if you want many hours, there's that. You might not get it. And now I'm a practice owner. So I opened my practice about 11 years ago in Fremont. I opened it from scratch. I opened it in the heart of Silicon Valley in a growing area. It's a suburb of San Francisco. And it is a growing community that's over around 250,000 people now. And then the surrounding areas are even more. This is a small portion of my office. I have sort of half open day and then 2 closed rooms. But I practice now how I want. For example, I don't do oral sedations, which I hated. I don't find them to be reliable, and I don't find that I'm comfortable sedating a child and then papoosing them and then doing a bunch of work. So I decided never to do it again, and I didn't. So I was really happy to be able to control that. I began with an office that was already a dental office, so it was already pre-made. I began with a 5-year lease, 1 chair, 1 employee. After a year or 2, I added another chair, then another, and then after 5 years, I was able to be busy enough to where I needed an associate, and I bought a standalone building. Now, in the Bay Area, you can't get a very big building. It's not huge, but it does fit 6 chairs. And I was able to, increase my employees and be busy enough to where I can work, 3 to 4 days a week if I want. My biggest difficulty now, I think, is overhead because, materials cost. It's expensive. My building costs are expensive, and then staff is expensive, especially in this area. So that's one of my biggest difficulties. I feel like the overhead is quite high. And then staff management. I'm constantly trying to train them, correct them, tell them what they should and shouldn't do, while also giving them positive feedback, which I'm not always very good at. I'm really good at giving constructive criticism, but positive feedback is difficult for me, so I work on that. But that's something that I'm constantly trying to get better at. Staff costs, managing personalities, training, hiring, firing, and then managing staff versus parents. So what I mean by that is you might have staff that tell you one thing, and then the parent is mad at them for them trying to follow the rules, and you want to please both. And as the doctor, I have to be kind to both sides, and sometimes I have to kind of find that balance. How do I please both while also trying to get a point across to the parent? you have to pay your bill, and then the staff, you should have charged them, before they left, for example. So it's constantly this game of, trying to please everybody and train everybody at the same time. So, but somehow it works out. So pediatrics, I feel, is a great specialty. I love it personally. I love it. As a woman and as a mom, I think it's perfect for me. I have a good work-life balance. I work 3 to 4 days a week. I take school holidays off. And then some people complain, and I say, well, I'm a mom too. And they say, okay, And so then they forgive me because I'm a mom too, for taking, spring break, winter break, holidays off, and they don't mind. I'll tell you what, it is tiring though, because we have a lot of patients every day that we have to see. It's kind of bouncing back and forth all day long. So it's tiring, and it gets really loud because a lot of them are crying for much of the day. So if you have little kids, that come in, you might want to just do the mornings with the little ones, so you can get your criers out of the way, and then you get to the teenagers in the afternoon, and it makes it a little bit more fun that way. Again, parents versus children. I have to treat the children, but I also have to really, really be careful and take care of the parents, because the parents are the ones who bring these kids in. The parents are the ones who make the decision for them. So you please the child, but you also have to please the parent and address the parent and discuss with the parent, and not make the parent feel guilty about whatever it is, having a cavity, not taking the best care of their child's teeth, because hey, I'm a parent too, and I know what it's like to tell a 12-year-old 100 times you have to brush your teeth. So I have a little bit of compassion in that sense. And the 2 pictures at the bottom will show you that there are different kinds of cries, and in pediatrics we know exactly what the one on the right is. And that is an angry cry, and the one on the left is a sad cry. She's crying, and she has tears rolling down her face, and we deal with each of these kids differently, and it's nice to be able to kind of know how to do that. At least most of the time we do. We think we do. I will tell you that I had dreams when I was in dental school. I had a lot of dreams. I had a lot of hopes, and they all came true because I wanted them to, and I made them come true. I always wanted to be a laser dentist, and I became a laser dentist a couple years ago. I have a CO2 laser, which cuts teeth and soft tissue, and it's beautiful and it's amazing. It's not perfect. It's not for everybody, but it's something that I really wanted, and I did it. That's my assistant there standing next to it. I also wanted to be a very high-tech office, and I am. We're fully paperless. We do, the forms online, and, surveys and reminders and all of that stuff for people. And I try my best to make it as convenient as possible for the parents, because I know they're busy too. I wanted to be a lecturer, and I became one. I made it happen. I wanted to practice, and I had a vision for how my practice would look, and I made it happen. But I also feel like I make a difference in kids' lives. I change lives, and I get to enjoy it. And I have these beautiful kids that come to me every day, and I just love it. Looking back, if I have anything that I would tell you that I would regret, is just to slow down. I listened to my father's advice to speed up. That's my dad right there in front of my office. Very proud man. I would say I would slow down. He really wanted me to, do college fast, go to dental school fast, finish so I could get started on working and have less debt. But it didn't make the experience more enjoyable. In fact, when I went to New York City, I kind of slowed down, and that's really, really when I enjoyed my life and my dentistry. And I would say enjoy every step of the way. It's great. There are moments where you are in despair, and you, like I said, crying. I cried my eyes out during dental school because I never thought that I would finish. Sometimes I had so many exams all at the same time. Didn't know what I was doing sometimes. But it works out. and you just have to enjoy it, look back, and say, at least I did my best. I would also say keep your family really close. Keep your family close, figuratively, literally. If you live close to them, that's great because you have all the convenience in the world. Mom will cook for you, dad will help you. If they're not physically close, at least keep them close to your heart. Call them, because they're going to keep you strong. They're going to support you. Take care of your health, your mental and physical health. I say always get exercise. It's going to help you study. It's going to help keep you mentally fit. It's going to help you feel better. And take care of your mental health too, because that's extremely important when you get older, to look at that. And that is it for my PowerPoints. I guess we can move on to questions if there are any.
Hi. One of the questions in the comments asked, how do you deal with calming down kids in situations that they're naturally uncomfortable in?
So there are a couple kids who can be calmed down and some that can't. And we know the difference. And sometimes we just know our kids. Kids are calm when they know what's going to happen. So we try not to let it escalate. So kids are going to escalate because they don't really care what you're doing. They're just going to be, or sometimes they have anxiety and other issues. Now, the kids who are just nervous, and we try not to escalate, is we do what's called tell, show, do. So we tell them what we're going to do, we show them what we're going to do, and then we do it. So we say, this is a toothbrush. I'm going to brush your tooth with this toothbrush, and it might be a handpiece with a little, rubber cup. It's soft and squishy. Here, why don't you feel it? And then they'll touch it and they'll squish it. See, it's so soft. It's not sharp. We don't say it doesn't hurt because we don't want to use the word hurt because then you're assuming that you're hiding something. Look, it's soft and squishy. It's, look at it. And I'm going to show you. And then you turn it on and you put it on your fingernail and you say, I'm going to show you like this in your hand. You turn it on and then show them. And then they're like, oh, okay. And then you turn the TV on and you distract them. So use tell, show, do, and distraction. And it works wonders. Some kids need a little bit of extra, help. Some kids need nitrous oxide. Some kids need a hand to hold because they're kind of jittery. We also have a weighted blanket for the kids who are kind of wiggly and really anxious. We put it on their legs. A lot of times they feel grounded with that on. So we have a lot of, tricks and tools that we use. But the number one thing is that we don't surprise them with anything. Everything we do that's new, the next step, we tell them what we're going to do very specifically in very special words.
That's very interesting, like how variable it can be. Another question I did have is you mentioned laser dentistry. Could you elaborate on the type of procedures and just like maybe a general use of laser dentistry?
Yeah. So with laser dentistry, it used to be that you had like a diode laser that you could just trim like skin with. So frenectomies, removal of, extra skin, things like that, biopsies. Now with the CO2 laser, you can actually cut teeth with it. And so you have a cavity, you can open up the tooth, do a cavity prep in order to get ready to do a filling. So you could do that. I do frenectomies with no bleeding, no burning of the tissue, and they look beautiful. So it used to be that you would have like a lip tie or a tongue tie, and you'd have to cut it and then suture it. With a CO2 laser, you just use that laser and you kind of peel away this layer of skin, and then you end up with like an opening with no bleeding and no need for stitches. You might need stitches for the tongue, but definitely not for the lip. And they heal beautifully.
That's actually really interesting because when I've shadowed my dentist, he's really good at stitches, but I always I'm always amazed by how troublesome, or in its nature it's troublesome, and how skilled you have to be to really suture there.
Yeah, because the oral cavity is wet, and our gingiva, our gums are thin. So imagine taking this thick string kind of tying it together, pulling it tight, and not ripping it, you know? So it's a very delicate situation to suture anything in the mouth. But again, the mouth heals really well. So you can kind of do a sloppy job at stitches and still end up with a nice looking healed tissue. Let's say you had an extraction done and you needed stitches. You could, you can get by with like mediocre stitches, still be fine.
Yeah. And then just to like elaborate, I know you mentioned that you really wanted to be like a high tech dentist. Just like, could you elaborate on like why and the advantages and some of the disadvantages
of the high tech?
Yeah.
I don't see any disadvantages these days because you have to keep up with the times. But with more technology, you get more problems. So I have an IT guy who comes like almost every day. It's like, this isn't being plugged in. The digital sensor isn't working, or something with the phones or down, whatever it is. So you always have to kind of keep your IT team kind of close, because technology is like that. You have to have more security because everything's online. So that's kind of a disadvantage. Of course, there's more costs. It does cost more. That's a disadvantage. But everything's smoother, faster. Everything's there. You can have like notes that are pre-made, and then you just fill it in at the end of the day instead of like physically writing every single note. So it makes it quicker to do your daily duties with more technology. And of course, with digital x-rays and things like that, no processing, no waste. You need to redo it, you just redo it, and it pops up on the screen. You can email the x-rays to anybody you need to. So it's quick and easy. And there's no need to if you were going to open something from scratch, to not have all the technology that's available to you. Now, you don't have to be a laser dentist, but you should have digital x-rays. I know it's expensive, but that's the kind of the standard of care now.
Another question I saw in the comments says, what advice do you have for building up your client base when you're just starting out?
Be kind, be generous, go easy on yourself, but don't limit yourself. So I actually didn't do a lot of advertising. I did a little bit. Have a great website. Make sure your website is up to date. If you have anything nice online, have a beautiful website. Spend money on that if you need to, and they're not expensive, by the way. Have nice pictures, nice photos, and sell yourself. But don't allow the patient to come in and then oversell dentistry, because they're going to come to see you. And when you are good to your patients, they will be good to you, and they'll tell others about you. They really will. But be good to them. Try to do as many procedures as you want to. And if you don't want to do certain procedures, just don't do them. If you don't feel like you're competent at them, there are many people you can refer to for anything that you don't feel like you want to do. Implants, cosmetics, pediatrics, area, whatever the case may be. If there's a procedure you don't want to do it, just don't do it. But if you do love certain things, get good at it. Take CE credits and get good at it, and tell people that you're good at it.
Well, that's a really interesting consideration. Don't do procedures you don't want to do. And when I think about like just the implication of like being like running your own practice, and like obviously I don't know how many procedures I'll like to do and I won't like to do, but like I just like what you just said, I just felt like it was like really like valuable and like important. But another question I have from the comments is there another specialty you would choose over pediatrics? Why not?
Orthodontics is kind of easy to do, I think. I don't know, orthodontists are going to be mad at me here. I think it's easy to do ortho. But I think I would probably, have a nice life being an orthodontist. But I think it would be really cool to be an oral surgeon. I always loved oral surgery. I thought that was a wonderful thing to do. It was very male dominated. When I was in dental school, I'm 5'2", very small person, and a woman, and I wasn't comfortable in the oral surgery department in some of the hospitals that I was at. And now it's changing. So I would encourage women to go into oral surgery. If you love it, do it. and don't look back. Just do it. Be a good surgeon. You don't have to be, 7 feet tall, and be a weightlifter in order to do it. Just you have to have your good hand skills and people skills. And I think it would be a great career for anybody. Another one would be perio. Would be kind of fun to do. I think they're all kind of fun. But I think endo is kind of boring for me personally. But that's just me.
And then, how many patients on average do you see per day? And then another question, just following up, is can you share some advice you have on time management during dental school?
Okay. So patients between 20 and 30 per day. On a slow day, maybe 20. On a full day, 30. I don't like to see any more than 30. It gets tiring. Time management, you have to kind of figure that out on your own. It's hard because you feel like you're never done in dental school. You're never going to finish studying. Like, you're just never going to finish. Like, you have like 4 quizzes a day, and it's like, what do I pick to study? Like, what am I going to ever finish? So you're never going to finish. Just do everything you can. In as little time as possible. So if you are like really good at taking notes, study those notes like crazy, or listen to whoever recorded it, or read the scribes. There's usually somebody assigned to doing the scribes. So try to do whatever works for you, whether it's color coding or it's reading something out loud or hearing or seeing. But study the way that you need to study, and then take breaks, and exercise. Exercising will help your mental state. If you're exercising, you'll be able to study better. And get off the phone. Get off your phone. Get off social media.
Yeah, I personally think that like getting some exercise while like you're kind of in like you're studying like regularly is like a great way to like keep in balance those two things. They both benefit you, obviously. And I feel like they just make you feel healthier and just better.
Definitely. And mentally ready.
Yeah.
And you're kind of more on top of your game when you exercise. You're not sluggish.
Yeah, for sure. Like, it always puts me on like I feel like I do better, I see better, and I feel better.
Yeah.
But that's all the questions I have. I want to thank you for coming on here. We really appreciate it, and thank you for your presentation.
No problem. Thank you for having me. It was nice.
Of course.
All right. Well, if anybody has any specific questions for me, you can always like private message me on Insta or wherever. But yeah, it was nice being here, and I wish everybody the best of luck. Hopefully, everybody gets what they want and can live a life